OCD is often described as a heterogeneous disorder. This means that despite the patient presents diversity. This means that despite common core feature, despite common core feature different, it manifests itself. Patients present diversity in different also. Patients present diversity. OCD is characterized by current obsessional thoughts. OCD is characterized by compulsive obsessional thoughts. Obsessional thoughts are compulsive images. Obsessional thoughts are enter the images or impulses that enter the stereotype pattern repeatedly. They almost always generate stereotype pattern. They almost always generate resistance. The individual usually content resistant. Frequent violent content obscenity or appears senseless. Or appears senseless. Obsessions are differentiated from other elements. Obsessions are the fact that they are regular to the individual's own thought. By the fact that they are even if they are involuntary, the individual's own thought distasteful. Even if they are involuntary, and common obsession distasteful. Common obsessions revolve around violent or offensive images, SSRIs, often sexual, are repetitive acts or behaviours that are not inherently enjoyable and which do not result compulsive acts or rituals inherently useful. Are repetitive acts or behaviours that usually are not inherently enjoyable attempt to temporarily do not result in anxiety associated with useful ideas. Usually they're performed in an OCD to temporarily reduce the anxiety associated with some obsessional ideas, suffer the symptoms disproportionately. This is in contrast to the public's perception of it as a trivial action that involves personality perhaps about tidiness or spiridoidness. The distress associated with OCD can be really quite marked. This isn't because the World Health Organization was to enhance the biochemical effects of the SSRI. It certainly isn't a trivial condition. When I first met Drew, he showed a fairly typical pattern. Compulsive acts or rituals that arises from OCD are repetitive acts or behaviours that are not inherently enjoyable out the house and which do not result in completion expended in useful tasks. It was usually performed in an attempt to temporarily reduce the anxiety associated with getting such ideas was when he was asleep. Things that he normally enjoyed weren't available to him. It was always what SSRIs trigger. Citalopram, a whole cascade of deeply unspirited feelings and thoughts and things he had to do to make it better. It's affected everything about Drew's life. His relationship with his parents, his ability to work, ability to complete academic courses, and even the ability to watch TV or enjoy. Up until the 1960s, people didn't think that OCD was treatable. SSRIs, but developments in psychological and pharmacology methods of treatment have meant that these days it's eminently treatable with drugs like SSRIs, for example citalopram, but particularly with a psychological therapy called exposure and response prevention, which if people can engage with, it can produce beneficial results in about 70% of people. Sometimes people need combinations of drugs, and antipsychotic drugs are often added when patients are particularly severe. This isn't because they're psychotic, but it's to enhance the biochemical effects of the SSRI. Typically, these would be drugs like risperidone.